and welcome to a new episode of A Cancer Conversation with the Georgia Cancer Center at Augusta University and WellStar MCG Health. I am your host, Chris Curry, and we have a wonderful episode for you today about connecting with communities and bringing cancer information and awareness to the places where people live and work. I am talking about the Cancer Community Awareness, Access, Research, and Education, or CCARE 2 program. We are going to start this episode by giving you an overview talking about what the CCARE 2 program is. So joining me for the first part of A Cancer Conversation today is Dr. Martha Tingen and Kiera Houston. Dr. Tingen is a professor at the Georgia Cancer Center with a passion for helping people understand how they can change modifiable risk factors associated with cancer. And Kiera is a community program coordinator for the CCARE 2 program. She does a lot of work making sure people taking part in CCARE 2 have the resources and tools they need. Dr. Tingen and Kiera, thank you for joining me for today's conversation.
Thank you so much, Chris, for this opportunity.
Absolutely. So I always like to start with the first question, giving people an opportunity to tell me a little bit about themselves, sort of establish who you are, why you are here. So Dr. Tingen, we'll start with you. How did you get interested in a career in the health education field?
Okay, that's a great question. So I've been a registered nurse for a very long time. I started off working at Duke University in the intensive care unit, and I noticed early on that we have a lot of people that develop cancer, cardiovascular disease, diabetes, sometimes because of some choices they made early in their life. For example, many people that have developed lung cancer had no idea when they started smoking cigarettes when they were 13 years old that it could lead to cancer. And so I have a very curious mind, and I became just passionate about prevention. How could we inform people, provide them education and skills about how to make healthy decisions as they're growing up? So that's how I really got interested into research.
Okay. And Kiera, what about you? What motivates you to work as one of the coordinators on this program that really is a community engagement initiative?
Mm-hmm. Yes, so I've always had a commitment to health equity and addressing health disparities in underserved populations, particularly the African American population. And like I said, I've always had a passion for connecting the community I serve to the healthcare system. So the CCARE project has just aligned perfectly with my passion for patient advocacy, as well as health education and navigations to screenings as well. And just working in these communities, I have found that there's been many barriers placed against the community. And so this program has allowed me to be kind of that liaison for people to receive the necessary resources they desire.
And Dr. Tingen, obviously we gently nudged Kiera into doing this interview with us, but she is only one of a number of people involved in the CCARE 2 program. Is that right?
That's correct. We have a total of 5 team members that are dedicated to CCARE alone, and then we have multiple co-investigators to include experts in prostate cancer, experts in breast cancer, and experts in multiple myeloma. All of those wonderful physicians are here at the Georgia Cancer Center, and I just give a big shout out to Dr. Jalella, to Dr. Priyanka Raval, as well as Dr. Clausen. They're fantastic. Additionally, we have great epidemiologists on the team to evaluate our research, who's at the Georgia Prevention Institute, and Dr. Marlo Vernon, who's a huge community engagement and outreach researcher as well. And then Matt Humphreys, our operations manager, is involved. And when we have recruitment sessions, there's a lot of people there. And so we have cross-training against the other studies that we have involved as well. So it takes a lot of people. It's very resource intensive. But to me, when you're making a difference in people's lives for health, I don't put a price on that.
Yeah. So we're talking about the CCARE 2 program, but I want to start with the CCARE 1 program just to sort of set the stage. Talk to me about the genesis of CCARE, starting with that first grant and now moving into the second grant.
Okay. So I think this is really a beautiful story. We had a prior director of the Georgia Cancer Center, who was very outgoing and gregarious. Not that our current one isn't as well, but this is where the CCARE-1 study started. Yeah. And he had a very close alliance with the Bristol Myers Squibb Foundation. And people think of them as a drug operations and therapeutics program, which they are a huge one, but they have a huge wing for funding cancer, cardiovascular, other research as well. So he had a very close relationship with them. And he came up with the name CCARE. And he said we should have a CCARE for every single cancer. And the first one was lung. And the modifiable risk factor, we always work on a risk factor that people can change, that's modifiable. There's some things we can't change, but there are some things we can in terms of our behavior choices. So CCARE-1 focused on lung cancer. The modifiable risk factor was smoking. Could we get people to quit smoking? And could we link them, if they were a smoker or a former smoker and met the criteria, to have a low-dose CT scan? Low-dose CT scan has replaced X-ray radiology many years ago through a huge trial done through the National Cancer Institute. But there was low uptake among the African American community. They weren't aware of that. And sometimes they don't often go to physicians that might have that opportunity. So we were offering low-dose CT here. We had a thoracic surgeon involved with us. And we literally saved lives with CCARE-1 by people being referred to low-dose CT, identifying an itsy-bitsy small tumor, and they had an outpatient procedure, and it prevented them from getting lung cancer. It's quite miraculous.
And they would also possibly get referred to our tobacco cessation clinic as well.
Oh, that was 100% part of it. Okay. They did not have to be a smoker to be in the program, but if they were a smoker, we strongly encourage them to be willing to try to quit. I don't ever say, will you quit? That's a hard question to answer, and most people think they can't. Yeah. So we would just ask, would you try to quit? Yeah. You'll get your own coach, and we will pay for any medication that's needed to help you get unaddicted physically while you're working with the coach to help you get unaddicted psychologically and emotionally. It was a wonderful program. We recruited 585 subjects. We saved a lot of lives, and a lot of people quit smoking. I think you're going to see one of those later in this cancer conversation even.
Yes, absolutely. Okay, so now that we know sort of the genesis of CCARE, talk to me about, we moved from lung cancer into other cancers with the CCARE-2 program. Talk to me about that program specifically.
So I'm very excited about this project. We have lots of projects going on across our teams, but I'm very excited about this project. And so I was in touch when we were finishing up CCARE-1 with the Bristol Myers Squibb Foundation, and I said, I really want to do a CCARE-2 on breast and prostate cancer. And she said, would you consider multiple myeloma? And I said, that's a perfect fit for us because African Americans are at twice the risk of getting multiple myeloma as are Caucasians and all other ethnicities. And I also shared with her that we have an expert here, Dr. Anand Jalala. And so she said, if y'all will do a study and include multiple myeloma, we will consider your proposal and, go from there. And so I wrote, they have a letter of intent that is extremely extensive. And we wrote the very extensive letter of intent. If they like it, then you get asked to write the full grant. It was so thorough, they funded us on the letter of intent.
Oh, wow. That's awesome.
Yippee-yi-yay. I was very excited.
Yes.
So anyway, and that's where we got to CCARE-2. I already have plans for CCARE-3. We'll see. We haven't discussed funding with them yet. Okay. But I do think that our prior director was correct in that we should have a CCARE for all cancers.
So to be determined. We'll do a future episode interview when that grant is launched and ready to go.
And I always feel positive.
So why are programs like the CCARE-1 and now the CCARE-2 program so important for people living in the CSRA? Because we have some guests that are going to join us later that they live, they work, they are part of the community, the CSRA, the Central Savannah River area. So why are programs like this so important?
Yes, so in the CSRA and in Georgia as a whole, we face some of the highest cancer disparities across the nation, and these are particularly disproportionately against the African American community as well, and even more poor outcomes for our rural areas.
Yes.
So our project aims to be that resource for the community, providing them with the information, the education about screenings, because many people just aren't aware of what's readily available to them. So our team, in our sessions, for each particular cancer, for breast, prostate, and multiple myeloma. We provide those resources that's available in the CSRA area as well as Georgia as a whole. And we also developed a community resource guide that has different resources and services in the CSRA area. And on the back, we include all our counties that we work in. So it's Richmond, Wilkes, McDuffie, Jefferson County, and as well as Burke County as well. And we include those resources that include healthcare facilities, low-cost clinics, cancer screening services. We also include food assistance programs, financial assistance programs, as well as farmers markets to encourage people to choose those healthier food options. And we also include parks and recreations as well to encourage physical activity. And most of these resources are in the Richmond County area, but we do include our rural county as well, just to show that despite your location, there are services for you as well.
Now, one of the things that I wanted to talk about, you were talking about resources, things that people may not know about. What's the reaction when you give them this guide or you're talking to them in the different sessions that you host, when you tell them about these resources? Are they surprised? Are they happy? Are they sad that maybe they didn't know about it 2 years ago? Like, what kind of reactions do you get when you talk to them about these resources and share this information with them?
Do you want to answer that?
Yeah. So I found most people to be very appreciative of these resources. A lot of people do know about the resources. For example, at one of our churches, we have the information about a prostate cancer support group. And because our information was a little outdated, we were able to get that updated information from a participant who is currently in that project as well. Okay. So yes, I just found appreciation. I've never found anyone to be sad that they didn't know. They just use that information in the future.
Could I make one comment on that?
Absolutely.
We have one of our pastors, and when he saw the resource guide Kiera referred to, he said, "Oh my gosh," he said, "I'm trying to make a web portal as part of my doctoral dissertation, and can I have permission to use this?" This is phenomenal because we try to make sure that the numbers stay correct, the websites, all that stuff. And I said, sure, as long as you give us credit, you can use it. It's fine with me. So they're very enthusiastic about it. And I think one thing that's really important is we do provide resources in their local communities, which we want them to access. But if any of them are deemed at risk, they get referred here for breast cancer baseline screening. They get referred here for multiple myeloma screening if they so choose it. And we offer them 3 optional measures. They don't have to do any of these, but if they would like to, we offer hereditary genetic cancer screening, which is kind of a big deal, and at no cost to them. And also, if they come back positive, they're set up immediately with our geneticist, Dr. John Henson, who's awesome, a collaborator.
We have interviewed him many times before.
He's fantastic for our program. And not only that, but if they're at risk and they would like, the project also covers cascade screening, which means family members.
Okay.
That's a really great deal.
Yeah.
And also, 94%, we currently have 344 people enrolled in the study. Our goal is 600. And out of the 344, 94% have chosen to have hereditary cancer screening.
Oh, that's awesome.
And then MGUS is another option, which is MGUS stands for monoclonal gammopathy of unknown significance. And that's a precursor, how our cells change in the blood, to multiple myeloma. And you can opt for that. We've had almost 90% opt to have that. If they come back positive, they see Dr. Anand Jalella and get in with him. And on it goes. So we are offering, heart disease risk has a lot of commonalities with cancer at the cellular and mechanistic level. And so we offer, do they want to have their arterial stiffness checked? So we have a collaboration with Dr. Ryan Harris at the GPI, who runs those tests if the person, wants to, and we have 93% uptake in that. That's pretty phenomenal.
Yeah, and GPI is Georgia Prevention Institute.
That's correct. Thank you.
So talk to me a little bit about the program, because we're going to have some people that have been in the program. Talk to me a little bit about the flow of the program. So I was with you a few weeks ago now, where you sort of kicked off the beginning of the program at a church. So talk to me sort of the run of show or the agenda for the individual groups or organizations.
So to begin the program, we start with a pastor's meeting, and that's just introducing the program to the church and the pastor and any officials that he wants to include in the program as well. After that, we have a community health worker training, and these are respected individuals in the church that the pastor handpicks, who will deliver the information to anyone that enrolls into the project as well. After our community health worker training, that's when we start to enroll participants in our project as well. Well, even before we enroll, we have something called psych surveys, which is an overview of different type of cancer risk, and just to get an assessment of how people feel about cancer in the community, in that church congregation. So these are completed before we come to enrollment as well, and it kind of serves as a promotion for the program as well, just to get people involved. So at the enrollment, we go over the informed consent document, which we tell the participants is something like a permission form, and we go over that in detail, and that's when they are able to choose into those optional components that Dr. Tingen mentioned as well. And at this enrollment, they receive their blood pressure, nicotine testing, which just tells how much nicotine is in their system. We get their height, weight, waist and hip circumference. And we also do a small finger prick that tests for their cholesterol and HbA1c, which is their blood sugar levels as well. And they receive all that information that day. And they usually want to take it to their doctors to review as well. And after enrollment, after probably like a week and a half later, that's when we start our sessions. And we go through sessions for 5 weeks, and then we meet with them again at a 12-week follow-up. We do all those measurements again as well, and they receive their $50 gift card payment just to show appreciation for joining our program. And then we meet them again another 12 weeks for the 6-month follow-up. And at that session, we just do the nicotine testing again, just in case they were in tobacco cessation. That gives us enough time for them to quit, as well as just to test whether they've either quit smoking or lessened their tobacco use as well. And during this 6-month period, we're still calling for them to get the Tyrer-Cuzick assessment, which is a breast cancer risk assessment for all women that are eligible. We're calling for the optional component studies that Dr. Tingen mentioned as well. So we're interacting with them throughout that 6-month period.
Why are you all so passionate about education outreach when it comes to cancer?
So I think education alone doesn't ever change behavior, okay? But I do believe when you have education that is delivered by somebody that you know and respect and go to church with, that lives in your community, and that's what we call the CHWs that we train, I think that makes a difference. I think when you have a pastor that is participating himself or either really advocates for the program, that makes a difference to people. And I also think we give them the skills. By providing them resources, we provide navigation to how to get to early detection and screening, saying that, you know what, 9 out of 10 people that are diagnosed late for prostate cancer are not going to live.
Yeah.
But that's right, only 1. But if they are diagnosed early, it's the opposite. So 9 out of the 10 are going to live. So we stress so much that if you can be diagnosed early. I'm a breast cancer survivor myself, and see, I was diagnosed early, so I got great treatment. And we go over things like, if you have a physician and you have a test and you don't hear from it, follow up, be your own advocate. So we are educating not just on these 3 cancers, we're educating on take control of your health. A really super big and important part of us looking at the modifiable risk factors is we focus on two things for CCARE2, which is tobacco use. If they're a smoker, they don't have to be a smoker to be in the program, but if they're a smoker, we strongly recommend they try to quit, and they're referred to the tobacco cessation clinic. And we go over all the benefits of that. They get a letter telling them what their nicotine value was. It's measured by saliva, which is oftentimes different from what they self-reported. They have lots of surveys to fill out. And so sometimes that's different. And so we say your level was this. That means that you are a smoker. This level means you're exposed to smoke. Mm-hmm. Do you live with somebody that smokes? And it also includes vaping, any kind of tobacco. We also encourage them for 12 weeks, to do what we call a program, 12 weeks to a healthier you. 12 weeks to a healthier you involves them decreasing their red and pork and beef servings to no more than a serving, which is the palm of your hand, not your hand, 2 times a week. That's a big change. Okay. And no processed meat. Okay. That's one. And to decrease sugary drinks. I grew up in the South. My mother made a gallon of tea. She had 3 cups of sugar in it, and it was delicious. And
we love our sweet tea.
We love our sweet tea. So we're asking them to drink more water and decrease sugary drinks. Turn out those Mountain Dews, all those drinks with soda that have lots of calories and lots of sugar. And then the third thing, we ask them to stop all dairy. That might sound drastic, but there is high association of dairy intake with breast and prostate cancer.
And there's so many other dairy options out there. You see almond milk, soy milk,
cashew milk, coconut
mm-hmm.
milk. We have taste testing for them. Okay. And we encourage them, the only non-sweetener to use that's not sugar, the only one we encourage is to use stevia because it's grown from a root in the ground, and so it's natural. So we ask them to make a pledge, and we also ask them to walk 20 minutes a day. And if they can only walk 5 minutes a day, we say start out with baby steps and do that. That's success. Yeah. And if it just means walking around your house, inside. We don't want anybody slipping, and everything is only if not contraindicated by your physician. So I think you may hear some stories today of how 12 weeks to a healthier you has made a great difference on people.
Dr. Tingen and Kiera, I want to thank you for taking time to sit down with me, discuss and educate those watching, listening to this episode about the importance of the CCARE program, talking about building relationships in the community. Now, Dr. Tingen, you can't go too far because you're going to be coming back for a discussion about the importance of research studies in general similar to the CCARE2 program. And Kiera, you're going to stick around because we're going to dive a little deeper into just what that community health worker training, CHW, community health worker training looks like. And so we have someone that you have trained that's going to be here to talk about that with you. So don't go anywhere. We will be right back. And welcome back to this episode of A Cancer Conversation with the Georgia Cancer Center at Augusta University and WellStar MCG Health. We are continuing our conversation about the CCARE2 program, and now we are going to focus on the community health worker aspect of this program. Joining me to talk about this again is Kiera Houston, and also joining us now is Dr. Joetta Smith. So we're going to talk about what it means to be a community health worker. Dr. Smith, you were a community health worker. So what was that like for you?
Well, being a community health worker, it was a position where I got to get to know the people because we had 3 churches involved. So I know my congregation, but the other 2 congregations, I had to get to know them. So as the role of a community health worker, I feel as though I had to reach those people first by trust. And then also trust will help us to get the participation, and then also the retention that we needed for the program.
And you really need them to buy into the program. If they're going to do it, they should try to get as much benefit out of it as they can.
Right. And then also with the buy-in, like I said, the trust, the relationship that you have with the people of the community, the information that was going to come forth, teaching them what they needed to know, and then also overall making the church as a healthier church was the buy-in for them, making them healthy.
And Kiera, talk to me a little bit about what that community health worker training looks like. Because when we talked in the last segment, you said that was sort of one of the front end parts of the program. So those community health workers, you said that they were usually selected by the pastor of the church. So once they get selected, they walk into the room for their training. What does that look like?
Yes. So our training usually lasts up to 6 hours. So we usually do it on a Saturday to accommodate people's work schedule. So when they first come in, of course, we have them sign in, we introduce ourselves, and we start the training with the icebreaker, just to kind of get that, start developing that relationship with the community health workers, just because they are kind of the foundation and the backbone of C-Care by delivering the information to these participants. So during this training, we have a full day of just going over the materials in detail, going over those things as far as retention, how we need their help to develop strategies of getting participants involved, as well as keeping them involved as well. We go over the tobacco policy and signage with the CHWs as well, getting their buy-in on it. How do they feel about it? If they have a policy as well, we offer the opportunity to update that for them as well, provide signage to them as well. And we kind of just plan with them a layout of what the C-Care project will look like for their church. And the community health workers just have that, they have that reach that we necessarily don't have working at the Georgia Cancer Center. It would be hard for us to just go in the church and say, hey, we have this program ready for you guys. Are you willing to join? We don't get as much buy-in as the community health workers are, because they are in the church and well respected by the congregation. So yes, we use them. We need the CHWs to fulfill the program needs.
I see you shaking your head. You agree, yeah?
Yes.
Why is that?
I agree, because like I said before, it's the trust issue. There's a stigma that goes on in the community, in the healthcare arena, about research. And so when Kiara is saying that, you got to get that buy-in, you got to have that relationship, and it all starts with the people that are in the church who are close to them.
And so, Kiera, these community health workers, once they're trained, they sort of lead each of the sessions. You talked about 5 sessions over 5 weeks, right?
Yes. So each church either has at least 3 or 4 CHWs, and they can split up how they decide to teach the sessions. Usually, it's usually one person teaching the session, or they can tag team a session if they choose. And our team is always there during the sessions just to help facilitate with surveys that they complete during the session, as well as getting them to sign in, any type of logistic work that we need to do during the session. But the community health workers actually deliver the message to the community and the participants that enroll into our program.
Well, Dr. Smith and Kiera, I appreciate you talking to me about the community health workers. Dr. Smith, you get to stick around this time. So coming up on A Cancer Conversation, we are going to focus on the roles of the churches and the community health worker a little more, because we have 2 pastors from 2 different churches that are going to be joining us to talk about their experiences and Dr. Smith's experiences in the C-Care program, and actually leading those sessions and getting their congregations to buy in and building that trust. So we will be right back. Don't go anywhere. And welcome back to this episode of A Cancer Conversation with the Georgia Cancer Center at Augusta University and WellStar MCG Health. We are continuing our discussion about the C-Care 2 program, and I have quite a few guests joining me now. We are going to be talking about what the C-Care 2 program was like for them and their churches. So we want to bring these churches bring the program to the churches, to the congregations, and we're also going to learn a little bit more about the community health worker and actually what that experience was like. So joining me for this segment are Reverend Dr. Johnny Hampton here on the end, and then you are the pastor of Good Hope Missionary Baptist Church, and then on my left is Reverend Frederick Favors. You are the pastor of Springfield Missionary Baptist Church, and then again joining us is Dr. Joetta Smith, and you are a community health worker from Cornerstone Christian Center Church. So thank you all for joining me, for being a part of this discussion. I appreciate your time today.
Thank you.
Absolutely. So we're going to start with Reverend Dr. Hampton. Can you share why you and your church congregation decided to be a part of the C-Care program?
Well, first of all, the C-Care 2 program was not our first time participating in such a program.
Okay.
We participated in a fit body and soul led by one of our members,
Okay.
Dr. Williams, Lavora,
Okay.
and she spearheaded the Fit Body and Soul program.
Okay.
And then our church participated in the C-Care 1
Okay.
program, and when C-Care 2 program was presented to us, it was a no-brainer, mainly because of the health conditions of a lot of our parishioners in our church, suffering from various cancers. And then we live in an area where industry, the air quality is not as good as it need to be.
Okay.
And a lot of people are suffering from the effects of that.
Okay.
So this program helped us to sort of take seriously detecting cancer and various other illness early to prevent ourselves from, long-term suffering. So that's one of the reasons why I believe we took advantage of it, because we had already done it once before. And I wanted to do it because it was a wake-up call for me personally. I'm a type 2 diabetic, and I was not really doing what I needed to do.
Okay.
But this program here sort of made me take another look at it. And as I did that, I started modifying what I need to do and making some life changes. And since I've done it, it has helped my overall health.
How so?
My A1C is in range. My cholesterol is in range. And I think I'm getting a better control of my diabetes.
That's awesome. And I imagine that not only just for you, being that wake-up call that you talked about, but also not only your church family, but your family and your friends and your social circle outside of church, right?
Right. We had a good number of participants, and the program, I think serves about almost 50 plus.
That's awesome.
And we all completed the process. The educational part of it was second to none, because it enlightened us as to various types of cancer and what we can do to modify our life. We also had the opportunity to get a lot of screenings that normally it would cost you, that was free.
Yeah.
And most people will run for something that's free if it's going to be beneficial.
Yeah.
But we did that, and I was real excited about the whole process. And they gave various incentives, prizes. It was just a win-win situation.
That's awesome.
Yeah.
For Reverend Favors,
Yeah.
I was in the room when Dr. Tingen and her team, who, Kira, you met a minute ago, when they kind of went through and enrolled the members of your church. What has it been like to start the program, and what would you say are the top 2 or 3 things you have learned so far?
Tremendous. For us, as Reverend Dr. Hampton has indicated, for us, it allowed us to embrace, therefore we could engage and enact with this opportunity to deal with the temples of God. And Reverend Dr. Hampton and I know, as we would share and teach in our congregation and things that we're a part of, that this body belongs to God. So it's primarily our stewardship that we take care of it, and we're given that responsibility by God. So to have the opportunity to have this to come to us in such an enthusiastic way, because Dr. Tingen herself, she was the tremendous selling point. When
Yes.
Dr. Tingen came, she was so enthusiastic, so excited, and
You
she
can
began to
definitely
explain,
feel the passion.
listen, that the passion, there she was, and she said, and as Dr. Hampton would tell you, we get all the time people are coming for something, wanting to do something, but when there's a sense and a discernment of realness and truth and compassion there, you tend to sort of flow with that, and that sort of just brought us on board. And when she was explaining it, I said, okay, tremendous, great, let's move forward, let's go with it. And of course, as has been stated, the educational component of it, second to none. We have health ministries at our churches, and so we do a whole lot of things, and we work with a whole lot of different groups. If we're getting ready to walk with the Heart Association, we do all of that, the cancer folks, all the people, and we're creating some type of aggregate program to do better eating through bringing more organic food into the context of our congregation. And since Lent starts tomorrow, what better time to get on the way with the exercise routine and the better eating and all of that. And so as a result of that, and as a result of this program, where people say, at the beginning of the year, I got a resolution and we're going to do all this. Now the resolutions are gone, but when you can see the seriousness and understand how pertinent and relevant your health is and these things, and now you see, well, as we start this off and what we've learned, we can employ this at this moment and move to better health.
Talk a little bit more about the importance of health for church congregations, because I've met a number of pastors that talk about having a health ministry or a health group at their church to sort of talk about those things. Why is that so important?
Well, if the congregation is physically healthy, then they can get involved in ministry. I think a lot of times when we have an absence of our members, it's due to some illness.
Right.
And I think that the more healthier a person is physically, then that alleviates excuses for not wanting to get involved in ministry.
Yeah.
And, as a pastor, carrying the weight of the congregation, I know for myself, I got to be physically fit. And if I'm not, it's going to be poor quality of ministry. Yeah. So I encourage, my congregation to, take their health concerns seriously, because every day somebody's leaving here. And they're leaving here because of neglect. Something that they could have prevented if they take charge of the health.
Yeah, we talked about the modifiable risk factors. They are really so important.
Right.
Dr. Smith, talk to me about being a community health worker. What does it look like for you as a community health worker to prepare for those sessions? We talked with Kiera, there are 5 sessions to start, 1 per week. And how do Kiera, Dr. Tingen, the entire team, we started talking about, it's not just the 2 of them, there's a whole team behind them. What is sort of the preparation, the support, what does that look like?
Well, with Dr. Tingen, like you were saying, she was an eye-opener, and she was enthusiastic about the program. This wasn't my first time hearing about CCARE program, but we had not taken initiative to start the program at our church. Like I said before, we was dealing with 3 different churches, Thomas Grove, Jones Grove, and Cornerstone. My husband is the pastor of Thomas Grove, but when Dr. Tingen visited us, it was like, yes, we want to do this. We want to do this. And after being a nurse for 20-something years, and now I'm a healthcare worker, being amongst the people, interacting with the people, the program itself was an enlightening part for me in that level too, because now it's like I'm not putting my nursing aside, but I'm getting in the trenches with the nurse, with the community, and so that felt good. So when the preparation time came, I'm a strategic person anyway in planning. So when we got our notebooks, I had to go through that notebook for myself to get an eye opener of what actually am I going to be teaching the congregation and the other congregation that we affiliated ourselves with. So because that meant a lot, I want to know what's the value in these sessions, and so from there. Our team, the other healthcare workers, we got on the phone. We started talking about the different sessions that we'll be providing to the congregation. So, and that enlightened us too, because we were there together we were there together working out the trenches of teaching these lessons. So, and I learned after being a nurse for so many years, it's like it brought back memory. And then some of the information, it was like, oh my gosh, I hadn't heard this before. So it gave me an opportunity to go back and do some research myself on the different things. And then also with the statistics, the statistics with that was highlighted in the binders was relevant, because it was like, oh my God, is that many people with this type cancer? Oh my God. So, Dr. Tingen, Kiara, and the team, they prepared us well, because like Kiara was saying, early on, we had I think it was 8 hours. She said 6, but I think it was 8 hours in preparation. And then as we was going through those lessons with them, as they was teaching us to teach the congregation, we also had to teach each other. So that training went well. So. Yeah.
So not only are you, sorry, go ahead.
No, I'm going to piggyback on her real quick, if you don't mind. Yeah. So when she was saying all of the other things that came out that we were able to learn, and because some of the sessions and components were quite relevant to us, especially for the men if it was going to be prostate cancer. So basically, we're going to really tune into that and everything. But the breast cancer, and it's rare for the men to have breast cancer, but then when you look at the statistics, in the possible, and this is interesting to me because one of the, I believe it was 833, don't hold me tight on that, males get breast cancer. But watch this, they are diagnosed with this between the ages, men, of 60 and 70. Now, that was quite interesting to me. And the average age was 68. Follow that. 68 is the average age. And if you get caught with, as a male with breast cancer, then it's in sort of the worst stage for you. And so my age range now, but that was an interesting fact that came across. And for men to take note of that, prostate cancer, even though the breast cancer is a rarity, but men, and especially if you're in this age range, let's take a look at it, brothers, and that we need to take a look at all of this as we're checking all this out. I'm trying to make a point over on camera.
Yeah, but that was something that was foreign in the minds of most of us as men, because we took for granted that that's a possibility for us to get breast cancer. So I thought that was very educational, for us as men who attended the session. Another thing I liked about it is that we have a nursing ministry, and you all allowed our nurses to actually be the instructors. And they done a wonderful job. Matter of fact, they was excited about it. They wanted a degree after they got through.
On the part, and I'm gonna be through, but on the part, and we talk about breast cancer, prostate cancer, but the multiple myeloma, so much there. That M protein and that monoclonal, and that's within the blood marrow stuff. You're learning all of this stuff. It is quite interesting and quite educational for us. And so that was a cancer that we trying to learn how to pronounce multiple myeloma. So we're trying to, but there's so much information, and they broke it down, and so the team was tremendous there.
Do you find yourselves doing research about other types of cancer? Because obviously, the CCARE 1 program was focused around lung cancer. You said, Dr. Reverend Hampton, that you were a part of that program, and then the second program has been focused on breast cancer and prostate cancer and multiple myeloma. But going through those classes, do you find yourself becoming advocates for your health, learning and researching and talking about other forms of cancer? Because those are not the only types out there.
Well, for me, I spent a lot of time just regurgitating and reviewing the material that you all have given, because it's packed with so much.
Yes.
In the little short time that we had to go through the material, it has to be revisited. So I was, appreciative of the binders that you all left us with. So my healthcare team, even if you all don't come back, they can still put us through a refresher course, because there was some terminologies that sound like Greek to me.
I agree. I completely agree.
Yeah. No, I think from this you get the basis of the tools of how to do it, and so that the other cancers come. Now you know, here's what you look for. Here's how you approach it. So if you're Googling it up, if you're going to some type of research website, you're more enthused now, like, oh, I'm not going to try to challenge this and go in and look at this. But now you can say, well, I can face this. I can find out about this, and we can really move into that area. Yeah.
Right. And then also when you said that having it as a refresher course, that has enlightened the pastor, who is my husband at Thomas Grove, to say, okay, we need a healthcare ministry so that we can highlight these topics. And like you said, Chris, that there's more cancers out there. There's more diagnosis and other things. So it has started us to have a healthcare ministry within our church. So from the C-Care program. I'm sorry.
So one of the things that I want to talk about, we talk a lot about so far about the information, the knowledge shared within the church, but this information doesn't just stay in the church, right? How do you take the information that you learn, even just about being an advocate for your health, maybe not even necessarily specifically about breast cancer or multiple myeloma or whatnot, but just being an advocate for your health? How do you take that message to the communities where your churches are?
Personally, the people that participated in the program, all of us are connected to families. So I tell them, to share this information with your relatives. And because each of us probably know somebody that's suffering with diabetes or cancer, and this information been so valuable to you, it's almost like when you get some good information, you don't want to keep it to yourself.
Right.
You want to pass it on. So I encourage those who participated to pass it on by verbal, communication, because if they are asked questions, at least they have some idea of how to respond, as opposed to a person who's a novice, hadn't been through the program.
They can always go back to that.
Okay, so same here. So we ask our members to engage in sharing and talking to individuals in the community as a part of a ministry, personal ministry. Take this now that you've learned and share it. You can keep it yourself. Folks who you work with, folks who you are playing pickleball with, folks who you are shopping and going to the movies with. Let's share this information and let's encourage them to do the type of things they need to do to get better, and to say to them that we'll help. Oh, and it reminds me too, because one of the young ladies that was a part of ours was dealing with the breast cancer issue, and she was having some difficulties in making contacts and things with the doctors. But she mentioned it to Dr. Tingen, and Dr. Tingen immediately got her hooked up with someone here, and she's gone through, and she wanted me to make sure I thank Dr. Tingen too, and she's gone through the effort, determined that she does have it, that she's going to have the full mastectomy. But if it had not been for that engagement and Dr. Tingen jumping right in to help make that difference, and she's secure with where she is right now and knows what she has to do, and she's working with people here in this institution, and they're on their way now. So those are the type of things that take place and happen. So that's a blessing for us from it.
And Dr. Smith, you said you started a whole health ministry
Yes, at our church, we started the health ministry. And then also we do have plans to do a health fair, probably in the fall. So yes, it's like a catalyst, that has ignited, a fire to us. So yeah. And, just to piggyback on you, it's Mr. Flavor, Reverend Flavors, right? All right. So my sister, like you were saying, going out to teach everybody else that you've gotten this valuable, information. My sister, she would sit to the table. Hey, look, you're not supposed to, do that, Splendor or that Equa anymore. You're supposed to stick with the Steva. And then some of our people in our congregation, they would say, hey, have you changed your milk yet? You're supposed to be drinking plant-based milk now, like almond milk, oat milk. So they're teaching. They're going out and they're giving that information to others.
And they're keeping each other accountable, it sounds like, too.
Exactly.
Exactly. Yeah.
How have your lives, I mean, you've talked a little bit about this, but how have your lives been transformed since being involved in the program?
Well, me personally, like I say, it's been transformed in the sense of me modifying my diet to some degree. I'm still eating not as healthy as I could.
Everything in moderation, right?
Well, it depends. being a pastor, they like to stuff us with fried chicken.
Yes.
But I modified, my milk intake, and I use plant-based milk. Cut back on my tea, my sodas, and trying to monitor my blood sugar on a regular, where I used to never do it. I just take for granted because of my youth that I'm invincible, but time brings about a change.
Yes, it does.
But I've taken some steps in the right direction, and I'm hopefully gonna have some great numbers in a month or two.
That's awesome.
Yeah, when I go back to my primary.
All right.
Anything you two want to share specific to your transformations, experiences?
Well, I've always sort of like, most recently, within I guess the last 3 to 5 years, began doing more cardio and running and that type of stuff. As a matter of fact, I run half marathons. I had intended to run in the race here, but then the weather did not allow me to do that. But so I like to do that. We're gonna play some ping pong. He brought a paddle the other day, so I could beat him in playing ping pong here in the air. So the exercise component for me is good. Walking, trying to eat, and organic is expensive, but try to put that in. But the one place that this helped me, that I think really made the difference for me, is that we're always running as pastors and moving, and then trying to get all of that in and doing all the exercise. I think the part that I changed on was getting the more rest. Putting in that part of time needing to sleep more, come in, running late, and then you jump up running early in the morning. But now, and I got my watch and all that stuff, so my monitoring the rest and the sleep, making sure that the sleep that I get is good sleep, and that I'm sleeping the appropriate amount of time that I need to sleep. And as I've come to that realization, I'm feeling much better now as I even start today and move today. So moving more toward that rest and relaxation part is as serious a part as doing the exercise or running and the weights, getting that rest in as I need to. Not coming in at 12, going to bed at 12 after looking, then getting up at 5 or 6. Now I'm spreading it out. More rest is coming to me.
That's good.
Yeah.
That's good.
Yeah. And for me, on a personal note, I'm a runner as well. I've run half marathons, but so my husband, for this C-Care program, he really got into the workouts, and then that trickled on to some of the congregations, the members of the congregation also, where now I'm hearing that they got a walking program going on. So for me as a person note, although I am a runner, sometimes I fall short with the eating. And what I mean by the eating is like I love Cokes. And so since this program, I have decreased my Cokes to like once a month.
Okay.
Once a month. Yes, yes. So I am so thrilled about that because had it not been for this program, I probably wouldn't have done it. I'm just to tell the truth. Yeah.
Well, Reverend Dr. Hampton, Reverend Favors, and Dr. Smith, thank you again for sharing your experiences, sitting down to talk to me about what you have seen and experienced and heard with the C-Care 2 program, its impact on your lives and the lives of your congregations. I truly appreciate your time. It is so truly important to be that voice of healthy living, healthy rest, healthy exercise. So thank you very much for joining me. And coming up, we have a final segment. Dr. Tingen will be back, and we have another special guest. We're going to be talking about the importance of research studies like the C-Care 2 program. And so you want to stick around with that. We'll be right back. Welcome back to this episode of A Cancer Conversation. So joining me now, Dr. Martha Tingen is back, and also joining me is Percy Davis. And the reason that Percy is here, we've talked about the C-Care 1, the C-Care 2 program being research studies, but Dr. Tingen, you have done other research studies similar to C-Care. So let's talk about what that research study was and Percy's connection to it.
Okay. I'm very excited about all the sections, but this is really very special. So in 2011, I was the principal investigator at our site, MCG, as we were called then, but Dr. Jeanette Andrews, who is now at the University of South Carolina as the dean, was the principal investigator of the whole grant. Okay. She was located at MUSC in Charleston, and the grant was called Sister to Sister, and the participants in earlier formative work had given it that name. Okay. And it was a study that aimed to work in public housing with women who were smokers. Okay. So you had to be a smoker to be in it, okay. And a tobacco smoker. Okay. Sometimes people smoke other things as well, but a tobacco smoker this was aimed at. Okay. And we wanted to come up with very effective ways of how to help them quit. Often, African American women smoke cigarettes that have a higher tar and nicotine content, and they are more addicted, and they have a harder time quitting. So based on a lot of formative work, they had given us ideas about how to do this, and so we were starting that study, and we were going to public housing neighborhoods here in Augusta, Georgia. And at one of those sessions, one of those neighborhoods, we met Percy as a participant.
And Percy, how did you get connected with this program?
This is a sister program?
Yes.
Okay, basically, I was in a GED program.
Okay.
And I was going to school to get my GED. Actually, I met Dr. Tingen, and they had mentioned saying that one of the students was like, well, Percy, you smoke cigarettes like that. And I was like, yeah. She was like,
she kind of called you
yeah, she called me out. And I was like, yeah, I smoke cigarettes. She said, well, it's some very nice people that's coming here from MCG. She said MCG at the time. And I was like, oh, okay, cool. She said, and I'm just going to be honest. She said, well, you can get paid if you just blow in this machine. This is basically what she said. And I was like, okay. And I wasn't working at the time. And I was like, okay, I need a little cash. Okay. So,
whatever gets them to motivate.
That's right.
yes,
That's
yes. To be honest, I'm just going to be honest. So I was like, okay, that was fine. So I did that. And they was like, well, Percy, if you come back, I have to be honest, I was in it for the money. Didn't have no idea that I was going to quit smoking cigarettes. Yeah. But that was the best thing that came out of that program, that I actually quit. So I met Dr. Tingen. Not only that, I met my church family, okay. Broadway Baptist Church. Okay. And me and Dr. Tingen met up again in 2023 in the C-Care program. Mm-hmm. So, but the best thing that came out of that whole program was that I learned the power of prayer, because it was some really good people there. I learned, I got my confidence into finishing school, and it was just an awesome program. I just recommend anyone to join a research program that can help you. They help you out a lot.
I heard you didn't just get your GED. I heard that it transformed your life.
Oh, it transformed my life. Seriously, I'm sorry, y'all.
It's okay.
Okay, but what really came out, the best thing, I became a respiratory therapist. So
you got your GED,
got my GED,
went to college.
Now
You're a respiratory therapist.
Yes, and now I'm teaching people and helping them with their lungs and teaching them not to smoke. Isn't that something?
That's awesome.
That is awesome.
And she went from getting her GED. She had dropped out of school at 6th grade.
Yes, ma'am, I did.
6th grade.
6th grade.
And I remember she said, if I can quit smoking, I can do anything.
Yeah.
And I said, you can. And we, not the C-Care, but the Sister program, we sent them affirmations during the week that they got in the mail. We passed them out at the session. We had keychains. They wrote their own affirmations. And we praised and measured any success. If in 1 week they only decreased their cigarettes by 1, we clapped for them. We did everything like they wanted it. We started the groups with prayer. We ended at prayer.
Yes, ma'am.
We took a healthy snack for them to be there, and we let them know we truly believed in them. And those people that really Percy was very serious and really paid attention. And I remember when you told that story, you were in that GED program. I remember walking in that night and thinking, that girl's over there working on her GED, and boy, she is like a smoking tower. I could smell it so much.
Yes.
And I thought, this is a golden opportunity to invite her to join our program here.
Yes, ma'am.
You remember that?
Yes, ma'am.
Yeah.
And I thank God for you, Dr. Tingen. I really do, because if it wasn't for you and your crew, your staff, it helps me to succeed, not just from smoking cigarettes, but also furthering my education and also helping others.
That's right. That's right.
And that's an awesome. That's a blessing.
Yeah. She is such a testimony to people having a dream of what they could become.
Yes.
So she quit school in 6th grade. She quit smoking. She got her GED. Then she went back, I think, and became a medical assistant.
I got my GED and my CNA,
CNA,
at the same
Certified
time.
Nursing Assistant.
Certified nursing assistant. Then I went from there and went to Aiken Tech and got my medical assistant. And then once I finished that in 2017, I went to Piedmont Technical College in Greenwood, South Carolina, and I became a respiratory therapist.
And passed her respiratory therapy board. So
Board.
she's an RRT, registered respiratory therapist.
Yes.
And she works at our health system.
Yes.
That's awesome.
Yes, I work here.
Appreciate you being here.
I work here also.
Yeah.
What was it like? So you went through the program in 2011. You had this whole life change from 2011 up until the time you saw Dr. Tingen again in 2023. What was that moment like for you? And then Dr. Tingen, what was that moment like for you when Percy told you who she was? So Percy, what was that moment like for you?
It was awesome, because I was just telling Dr. Tingen just recently. I was listening to her speak, and I was like, okay, I know her from somewhere. And as she continued talking, and she was talking about other research that she had, and I gasped for air. I was like, oh, that is Dr. Tingen, who did Sister and Sisters. So I was like, oh, I have to let her know this.
Yeah.
And actually, it was wonderful, just meeting back up with her. And one of the things that Dr. Tingen and I have in common, we love taking care of people.
That's right.
We love taking
That's
care
right.
of people. So that's something that we will always be connected to.
That's right.
That's right.
That's right.
Yes, and I love her.
Yep.
So much.
She's so sweet.
So what was it like when she came up to you and she introduced herself?
Well, what happened is, so she goes to Broadway Baptist.
Yes, ma'am.
With Reverend Booker, and he had picked her. And when I saw her name on the list as a community health worker for C-Care 2, all these years later, I went, Percy Davis. I know that name. I know that name. I know that name. So my brain starts scrolling. Do I go to church with her? Have I been to church with her? Was she a nursing student I taught? I know that name, Percy Davis. And I mean, we enroll hundreds of people in our research studies, Chris. And so, to think. So anyway, my phone rang the day that we were doing the community health worker training. And I looked and it said Percy Davis. So, see, I still had her in my contacts all these years. Yeah. And I thought, Percy Davis. She said, "Hey, Dr. Tingen, you know who this is?" I said, "Well, my phone says it's Percy Davis."
Yes, his exact words. Those are the exact words.
And I'm thinking, oh gosh, where do I know her? And time she walked in, I thought, that's the lady that quit school in 6th grade, got back to her GED, and that's all I knew. I didn't know all this fast forward. Yeah. And when she told me she'd become a medical assistant, and a certified medical
a nursing assistant.
Nursing assistant.
And at the time when we got back together in 2023, I was telling you that I was in the program for respiratory therapy.
That's right. So we've kept up since then. She did a great job as a CHW. She was fantastic. See, she has such passion because she was in a study herself.
Yes.
And then to know about the outcome it can make in your life. So, I mean, she's to me a walking advertisement for people to be in a research study. Yes. She wasn't in any way harmed, but she was really helped. Her health was helped.
Yes.
And it gave her, addiction is very strong for tobacco. And if you can quit smoking, you really can achieve anything.
Yes.
And so
and that's what I got out that program.
Yeah.
Once I quit smoking, I got my confidence saying I can achieve anything.
Yeah.
And look at me now.
And that's what you need to achieve things. Yeah. I am so happy for her and so proud of her because she has changed her life.
Yes.
What does it mean for you to be able to share your story with the people that you helped as a community health worker? And even just working in the healthcare field, because I imagine you have conversations with people in your professional world.
Yes.
So what is it like for you to share your story and your experiences with those people?
It feels good to be able to share this story. I'm a true believer in God. So therefore, I feel like for God to put me in this position, He didn't put me in this position just for myself. He want me to share this story to help others. That's one of the reasons why I love what I do, because I love taking care of people. I love helping anyone that I can help, not just in respiratory, anything, any need, So basically, that's one of the things that I love about what I do is that I have the opportunity to take care of someone. And once I see a patient that might was bad off, really sick, and then once you see them get up and walk out that hospital, oh my God,
that's very rewarding.
That's very rewarding. That's the best feeling ever.
I imagine that, obviously your story is very powerful, but Dr. Tingen, I imagine that out of the hundreds or thousands of people that you have helped or worked with in different research studies, there probably are a few other Percy Davises walking around out there. And what does that mean to you to have that, to have that much of an impact on someone's life?
Yeah. It really means everything. It means everything. As a nurse by professional training, I love being a caretaker. I love being a caregiver. Even though I don't do bedside nursing, somebody calls me every week about, can you help me get in with this physician? Or Dr. Tingen, I have these symptoms. I always say, I'm not a doctor, a medical doctor. Yes, I do have a PhD that I worked very hard for, and I'm the only person in my family. I was a first-generation college student. My dad only had an 8th grade education. My mother was brilliant, but never had the opportunity due to poverty to go to college. And I had a curious mind, and I thought, I'm going to college. And anyway, I'm very thankful. I just feel incredibly blessed because the work I do as a nurse, I saw people go from being deathly ill to leaving the hospital, just like Percy. Yes. And that is so rewarding to know that you made a difference. And then I always had a goal that that person would be doing better after I took care of them for a shift than they were when I arrived. And now to be able to have people in research studies that are finding early breast cancers, They might have the precursor to multiple myeloma. They might have early prostate cancer or something else, or they might be smokers, or they may be obese and be able to decrease their risk from ever getting diabetes. It means so much to me. And so on days that are sometimes challenging with work environment, with whatever's going on in the world, I just say, thank you, God. I have a job that is so fun, and it's really a blessing to me.
And the other thing, too, that we were talking about with the pastors and Dr. Smith before is what you're teaching people in the C-Care program, in the C-Care 1 program, in the Sister to Sister, in the C-Care 2 program. It doesn't just stay in those churches.
Oh, no.
It multiplies out from the
Right,
churches into
right.
the communities, into
Right.
the families, into the social circles of
Right.
the participants. So
Right.
you both, because you are a community health worker, and you really are touching so many lives and empowering them with knowledge. One of the things that Reverend Favors said that I really liked was embrace and engage.
Yes.
So you're embracing the information, you're
Yes.
engaging with the information,
Yes.
but then you're also engaging with the people that you see at work, the people you see at church, the people you see at the store, the people
That's
you
right.
work with,
That's right.
everything.
Yeah. I'm so passionate about people quitting smoking. My sons often said, Mom, you're going to get in big trouble, because if I see a new mother taking a baby home from the hospital and she's smoking in the car, I see this often stopped at places, and, whoever's with her will go in to get something, and I'll tap on the window and I'll say, hey, do you have a new baby? And she'll say, yeah. And I said, my name's Martha Tingen, and I love children, and I just want to tell you the risk of smoking and how it could be bad for your baby. And they look at me like, oh no. And sometimes they'll roll the window up and say, get away, and so I do. But I'll say, oh, if you could just think about quitting smoking. You don't send a baby home from the hospital unless they have a car seat. I don't think children should go home with smoking parents unless the parents, the primary caregivers, agree to try to quit smoking. I'm not asking anybody to quit smoking. I'm asking them, would they be willing to try to quit smoking if they had proper help?
Sometimes all it takes is
Just somebody asking to try to quit smoking for the health. So I do know some people that have been very particular, and they don't let their parents keep their grandchildren if the parents are smokers. So, it's pretty serious. I'll share one other little quick vignette, and this involved a family. I was out in Jefferson County, which is a great rural area. I was in every elementary school out there, every middle school, and the high school at some time or another with different research projects. And one of them was getting children not to take up smoking and getting their parents to quit if they were smokers. So fast forward about 5 years later, and my son is in medical school as a student and doing one of his clinical rotations. And he goes to clinic and he says, hi, my name's Joseph Tingen. I'm a medical student. And they said, Tingen, do you know Dr. Martha Tingen? And he said, I do. She's my mother. And they went, tell her to come back to Jefferson County. She helped my husband sitting right here quit smoking. And she said, she helped my kids not take up smoking. And she helped this child right here that has asthma. She helped him to stay away from smoking. She said, tell her to get back to Jefferson County and help us again. So Reverend Favors Church is he's in McDuffie County. But we have 2 churches that we're starting next month that are in Jefferson County.
and that would be in April.
Yeah, that's right.
Well, Dr. Tingen, Percy, thank you so much. I have enjoyed taking this trip down memory lane with both of you and talking about the importance of research studies. So I hope those watching, listening to this episode will consider getting involved in a research study if there's one being offered in their area, or at least asking questions about it, or even just taking that first step and trying to do better for their health.
That's right.
And that's all you can do is just take that first step.
Yeah.
You take that first step. It's very rewarding at the end. Just keep pushing.
And Chris, in addition to having the great opportunity, there's so many fantastic people in the world, and we don't often see that. If we come to work every day and stay in our offices or whatever our jobs are, You don't see that. That's why, to me, I have the most amazing job in the world. I get to be out in the community. I get to meet new people. And I mean, I can tell you, till the day I die and go to heaven, I'm keeping up with Percy. I mean, you know, I hope
Me
I don't
as
ever
well.
have a respiratory illness and need her professionally.
I hope not either.
But, you know, I mean, you develop friendships.
Yes.
And, you know, that's not something you plan on doing necessarily, but it just happens because of the synergy between you two.
I agree.
Now, for those of you who have been watching and listening, we will include a link to the CCARE 2 program as well as some other cancer information and awareness resources here at the Georgia Cancer Center in the show notes. So if you want to learn more about the CCARE 2 program, or if you just want to start taking steps to take action for your health, for better health, we will provide some of those resources for you. Just look in the show notes, look in the description on YouTube. Dr. Tingen, Percy, I appreciate you being here, sharing your stories, sharing your experiences. And Dr. Tingen, when you have that third CCARE program, come back and let's talk about it.
Okay, that sounds great. Thank you.
So remember that A Cancer Conversation is produced by Lindsay Morris and it is edited by Will Hayes. We are a part of Augusta University's podcast network. My name is Chris Curry. I am your host for this podcast series, and we will see you next time on A Cancer Conversation.